Hello, my name is Bienvenu, and today we're going to talk about ET tubes, um, endotracheal tubes, and the care for them. First off, you want to check your physician's orders to make sure that this physician has indeed ordered the care for this patient's ET tube. For the purpose of this video, we're going to be using this mannequin with the ET tube. Obviously, it's hanging too far out and it's not secured. There's different methods to hold this in place. There's a tape method. There's a commercial, the tube holders, where it's like a thing that goes over your face and strap it down with like a Velcro. Um, for this purpose of the video, I'm just going to talk a lot of these things through because we obviously don't want to be taping all over the patient's face and don't have the commercial tube holder. But first off, so check your order from your physician. Make sure that you get your patient correct identification on their armband, the first and last name, their their date of birth compared to your chart or your MAR. The next thing is you want to make sure that you have a towel to cover on your patient. And also, as I said in the prior videos, make sure that you tell the patient what's going to take place so that they can feel more comfortable, because they may be nervous or whatnot. But so cover your patient in case secretions or any kind of volume of fluid comes on a patient, that they remain clean. So we drape a towel over them, connect all of my suctioning to my device to the suctioning. Purpose of video, I will be using the syringe, which is not the correct thing. You actually have like it's a long device like this big. It's just a suction tool. It connects to the suction. It's just a continuous suction. It's not like a pulsating deal. Just connect straight to it. And so we're going to use this today. First thing is we want to make sure, obviously, get a baseline vitals, their O2, get all of their vitals. To make sure that if there's a decline, then it was related to our care here. It wasn't, but prior or whatnot. It's always good to just establish a baseline so you have something to compare to. So we have the suctioning here. I'm going to come in and I'm going to turn this aside, and I'm going to start on the other side, kind of coming across the patient, say here. Also, I want to note the distance, the numerical value on the tube, that we remain in that same range. We don't want to dislodge it. It come out and it'd be a smaller number, or further in it'd be a larger number. We want to make sure that that number stays the same throughout this whole process, because if it's out, then it's going to be a different number if it's in. So make sure that you maintain that same numerical value throughout this whole process. First off, I want to come in, I'm going to suction any kind of obvious secretions. Making sure, obviously, if the patient had the big strap, commercial deal on the tape, that we may remove that and replace it. There's a bite block, then you have to obviously move that as well. So we're just going to clean in the oral, suction out any heavy secretions. The next thing is, like I said, remove the bite block. Anything that kind of prevents where you can get in there and really clean the area. Remember to never put your fingers inside of the patient's mouth, because they may not realize that if you go and stick your finger and they bite down and bite it off. It's really important that you protect the patient's tongue and as well as your fingers. So I suction the obvious parts in here. In the hospital, there is a device where you can do oral hygiene, which would be next. There is like the green things that connects. It connects to the suctions, and it acts in theory as like a toothbrush, and you can brush the solution on there and suction as well if the patient, so it prevents aspiration with the suction. That's the reason I do that. I know some places don't have that capabilities or whatnot, so they have a traditional a toothbrush, and they toothbrush it, but try to limit the amount of volume of fluid that you're going to put in the patient. If they're unresponsive, again, we want to prevent aspiration. So check your facilities. They may have it in the supply rooms. to make sure that if they have that, then why use the toothbrush when you can use the green sponges with the pad or the solution on it, the oral hygiene, and it connects to the suctions for aspiration. At that point, you want to again document or note in your mind that the numerical value on this tube stays the same throughout the whole process, so it doesn't dislodge or move in and out of it. You want to obviously don't just clean one side of it. You can move it over. Just be careful when the initial suctioning or when you're doing the oral hygiene. Make sure that you're cleaning all around this, making sure that there's no breakdown on the top of the lip or on the tongue. You thoroughly assess the patient completely. That after we assess all this here, the oral area, the mouth, make sure that you do not put your fingers in it. He'll bite it off or she. Also, you want to, at this point here, we can then, once everything's clean, go back and fasten it down, the ET tube, whether it be the tape method or if you want to do the commercial tube. It has like literally a Velcro strap that comes around and fasten it down. There's two different methods depending on what facility it has. That is basically the oral ET care. You can further assess your patient, make sure to see if they need suctioning. You can get your stethoscope and listen to your patient. At that point there, as a nurse, you can decide if the patient needs it or not. If the patient doesn't have any secretions, then don't stick the suction down because it's just going to irritate it. But if you do hear any adventitious sounds, mucus in there, you want to make sure and get that out because that could prevent the patient from breathing properly and an airway, just prevent that airway from being able to breathe easily and flow, airway clearance. So if the patient doesn't need to be suctioned, then you would just transition to the next part would be your documentation. If he does need to be airwayed, you would do your normal step like in the previous video. You would just do your suctioning. But for the documentation, you want to make sure that you document the patient's response, document the patient's color of the secretions that if you did suction, document if there's any odors, make sure that you document any breakdown inside the mouth, and as well as the teeth as well, making sure that there's nothing loose that could be potentially become dislodge or break loose, and make sure that the patient is just make sure that their breathing is O2 is within normal limits, and that is all to ET care. I know that was pretty quick, thorough, went really quick through it, but without having the mask and without having the tape, verbalize a lot of things, but that is the bulk of ET care. Thank you for watching, and again, make sure that you do all your proper verifications initially before performing the wrong task to the patient, and as well as even if my thing is even though they may be unconscious, they still, I believe they can still hear you. Definitely just tell your patient what's going on. Introduce yourself. Have respect for your patients. And just tell them the procedure you're about to perform. Never just walk in there and just go straight to the patient's mouth and just go to town on it. I mean, these are still people, and we need to have respect for them. And just always remember that. You know, you would want your family to be treated. And that is all to ET Care. And thank you so much for watching. And my name is Bienvenu.